Welcome once again. I'm Dr. Pauline, the Director of CHALIANA Medical Center, pediatrician by profession, having 7 good years working experience and working with a lot of passion and dedication. And for today's topic is about malnutrition, a continuation where we had started initially. So we are supposed to keep on following up so that we get the current tips on how to manage it well and treat our child, because these are our future, our assets. Thank you. So today we are going to understand what is malnutrition and how does malnutrition comes about. How are we going to take care about our children, and what are the causes of malnutrition? Malnutrition ama lishe hafifu ni it's a way whereby children are being fed food which is insufficient ama sometimes which is overfeeding. When the food is insufficient, we get that the baby can get malnourishment, stunted growth, and also we can get the baby getting wasting. And when the baby is being overfed, the baby develops what we call obesity. So as parents, the only way we can sustain our children is just to ensure we have fed them well, good nutritious food, that is proper hygiene, proper nutrition, proper educating our caretakers at home. And remember, with the current situation when we have natural disasters like rainfall, which is affecting maybe water which we take for drinking, food which we prepare for our babies and the kids. In one way or another, if we are not going to take care of them or to prepare them adequately well, our children might develop what we call diarrhea and vomiting. And this diarrhea and vomiting, when it persists, it can make the immune system for the baby to be low, making the baby susceptible to a lot of diseases. And when it's not being taken care of, you get the baby can get malnutrition. Another way our child can get malnutrition is through maybe improper introduction of food to our babies. And this food, especially when the baby is being, let us start when the baby is so young. Maybe the mother is a newborn. The mother is new in this field of breastfeeding, doesn't know how to breastfeed the baby well. At the same time, doesn't know how to put the baby in good positioning and attachment so that the baby is able to get enough milk adequately. And at the same time, maybe the baby is breastfeeding and is removing some sounds, which in the real sense, the mother feels that the baby is taking adequately, but in actual sense, the baby is being underfed. With the repetition of the same, you get our baby are now getting to lose weight. They start to be lethargic in such a way they get to sleep a lot during the day. And sometimes the baby gets to be sleeping a lot. So once you recognize such, it's not a good way to bring up a baby. Kindly bring the baby to the hospital so that you are able to be educated well how to position the baby and how to make sure the baby is getting enough milk and how to make sure that our baby is getting milk, not only water. Why am I saying that? I'm saying because how the breast is being created, it has a lot of components. First of all, the first milk that comes from the baby comes from the mother while breastfeeding. That breast milk is just water. And that water is essentially for quenching the thirst for our babies. Number two, the milk which is coming after that first milk, it is carbohydrates. And that carbohydrates are there to make the baby grow and at the same time have energy. After carbohydrates, you get the baby gets now proteins. Those proteins are body building for a baby to grow well. So when you get a mother breastfeeding only water, si maajabu unapata mtoto agrow vizuri, mtoto anazidi kudofika na mama anazidi kuzononeka, hana usingizi usiku, mchana yote hana usingizi. Hata kazi za nyumbani unapata zinafanya nini? Zinatatizika. So solution ni moja. Ni mama hafundishwe, more especially first mothers, on how to take babies well, on how to breastfeed them, and at the same time, how to make sure the baby is taken adequately. Because after the first component is water, second is carbohydrates, that is proteins. Now we come what we call lipids, which are fatty lipids. So when the baby is being balanced with that components, you get the baby is growing well, adding weight well, and even from the face, you can see the face is glowing and shining well. So for our mothers at home, caretakers with the first mothers at home, kindly ensure that you assist those first mothers on how to take good care of their babies. Not only that one, we get also various ways how a baby can get malnutrition. How? Once the baby has been breastfed for exclusive 6 months, which is the required time for the baby to be taken care of until 6 months, because it will boost immunity to a baby. Secondly, you get that the baby is growing well and they start bonding with the baby and the mother. And at the same time, it reduces diseases to the babies. Yani, they are not prone to certain diseases like diarrhea and vomiting because already the mother has given immunoglobulin that are being found in the breast milk. So when the baby is not breastfed well, that's exclusive for 6 months, and it happens the baby has been introduced complementary feeding. The complementary feeding can be in many forms. A good example, mother has insufficient breast milk. It could be maybe the mother is sick, mother is not getting enough food at home that can make the milk to be in plenty. At the same time, you get the stress and depression among the mothers. So, with subsequent feeding practices like such, especially maybe cow's milk introduced to a baby, a young kid with immature lungs, immature liver, immature kidneys, how do you expect our baby to grow well? It cannot happen. Why? I think there's somewhere whereby I spoke about how to differentiate between none which is equivalent to breast milk and cow's milk. Why? Because the cow's milk, the kidneys are not able to do what we call, whereby there's a lot of retention of the cow's milk. In such a way, exclusion process is not taking place well, and compared to when the baby is taking none or breast milk. You get the baby once has taken the cow's milk, that milk takes a lot of time to be digested. Why? Because there is immature lungs, immature kidneys, and the immature liver. So detoxification of the process is slowed because of that fact I have told you about. Okay, another way you can get that a child can get can get malnutrition. It can be due to certain factors. Maybe sometimes we are not able to control some situations. And when it comes to that, you get the mother maybe a chronic disease. A chronic disease like breast cancer. Breast cancer can get anyone of our mothers or any one of us. But once we realize there's that breast cancer and maybe the baby has been born, it's unfortunate now some babies get to be born in a family whereby they are really struggling even to get food on the table. How are we going to take care of our baby? How are we going to provide enough and sufficient milk, which is good and palatable to the baby and for the digestion purposes? So for us to get to understand more on that, follow more for more details in the next video so that you get to be engaged and educated on how to make sure those kids are well taken care of. Thank you.